Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, summer is here. My hat's on and we're ready. First thing we're going to talk about is sun protection, my favorite topic. So the sun releases two types of rays, UVA and UVB, that we care about. You can remember these because UVA affects aging, UVB is sunburn and it's bad, i.e. it can cause skin cancer. You want to make sure that you're getting protection that covers UVA and UVB rays. So usually on sunblock that will say something like broad spectrum or UVA/UVB. You want to look for that as well on clothing articles if that's something you're looking for. Most people in their minds when they think about sunblock and sun rays only hear the sunburn and the bad skin cancer part of the UVB. But if you are watching this video, you probably care about the aging face at least a little bit. So this is why the UVA part is really important. And there's this very famous picture of this truck driver who only ever had sun exposure on the left side of the face, because you can imagine that's where the window is. And you can see in the picture how much older that person looks on that one side. Next, on the topic of sunblock, my favorite is there are two main types. There is chemical and mineral. Both of them are extremely effective, but they just work in different ways. Mineral sunblocks usually contain some kind of zinc or titanium oxide ingredient, and they act as a physical shield. So you put it on the skin and then it blocks the sun from getting penetrated into the skin. Chemical sunblocks contain a bunch of other compounds such as avobenzone, oxybenzone, and the way they work is these chemicals get absorbed into your skin and then they cause a reaction with the UVA and UVB rays that helps neutralize the rays. Both are equally effective, and you kind of just need to pick what works best for you. I will tell you a very common difference in terms of the application of these sunblocks is that mineral sunblocks tend to be a little bit heavier, a little more of that white cast, although you can find a lot more sunblocks now that are using more advanced technology so you don't experience that. So I would say pick a sunblock that works best for you, whatever will encourage you to apply frequently and in the right quantity. So I happen to have a sunblock here today. This just happens to be the one I'm currently using in my bag from Trader Joe's. I picked it up actually because it was supposedly a knockoff for the Supergoop and I just wanted to try it out. And you can see here, if you're zooming in, broad spectrum SPF 40. So it's broad spectrum, meaning it's going to get UVA and UVB rays. If we flip to the back, it has the ingredients. These are all chemical ingredients. So this is a chemical sunblock. And I'm going to show you how much you need to apply and actually do it. So most people do not apply enough sunblock. For your face and your neck, you should do something about this much. I did not do a very good job, but 2 fingers is right. And what I do is I take this and I go and I rub it into my face, like so. And I'm glad I'm doing this right now because it is really bright right now and I'm probably due to reapply anyway. On that note, I will say that when you're applying your sunblock, applying it in the morning is not good enough. You do need to reapply it every 1 to 2 hours, otherwise you're losing the effects of it. That's a very common error that patients have. The other thing too, volume, we talked about that. For your whole body, you're actually supposed to apply about a shot glass worth of sunblock. So I want you to visualize in your head how much sunblock that actually is. And then there are a few areas that are commonly forgotten about that as a head and neck surgeon, I really care about for your skin cancer safety. And that is don't forget the ears, don't forget your scalp. Last thing about sun protection is we have all these great blockers and tools, but at the end of the day, you just want to minimize your exposure to the actual sun rays. So that means things like shields, such as a hat. You want a broad rim hat, hopefully blocking a decent amount of your face. Like I think this should be shadowing my face. You want to avoid the sun when it's at its most intense rays, which are usually around 10 to 2 o'clock. And then there are all these really fancy clothes now that you can get, like rash guards and things to physically wear, so that way you block the sun from actually getting and hitting your skin. So that was today's episode of Face the Facts. This is Dr. Lexie Wang, a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. And make sure you stay safe out there.